So the bell has rung and we'll start. I am fine, Dr. Sai. I hope you all are fine. Hi, Dr. Dhananjay. So friends, welcome you all to Sail to MDS Dental Academy. So I hope you all are fine and taking care of yourself and your family members because of this COVID-19 situation. So as everybody know that today the topic of interest is what after BDS part 1. So what all options are available after BDS? So as we see most commonly the main four options available are first is doing MDS, second is clinic opening, third comes there are aspects like going to abroad, maybe in the USA, UK, Canada, Australia, etc. And fourth option is always against to this option that leaving the dentistry and going for some other thing like MPH, MD, etc. So today we are going to discuss for two options, that is the clinic opening and abroad dentistry in detail. Fine. So as we know, dear friends, the situation is almost demotivating for all of us. Once again, the lockdown has been announced by our Prime Minister, and we all are again in the house, and a lot of negativity is there around us, and we have to convert those negative into positivity, because you have to work hard for your future. This condition is there for, we can say, around 2 to 3 months, but you cannot decrease your, or you cannot leave your that mojo. You have to keep on working. So what I do when I get demotivated, how you can self motivate yourself? The best way to self motivate is the imagination. Imagine the ideal situation which you accept. For example, right now I also feel demotivated sometimes. What I feel that what at that time I imagine that I am working again with my pedo patient, or I am doing my anesthesia case, etc., etc. That again gives me energy, and I become that demotivation slightly get converted into motivation. So like that only you people can imagine whatever your dreams to open the clinic or to go abroad or want to do MDS in your favorite department or like that. So try to imagine the best thing you can imagine and decrease your negative level and keep on working. So hi Manpreet, thank you for your nice words. So friends, remember you have to motivate yourself. So today the topic is not like that I am your teacher and I am telling you. It is a friendly interaction. You know, sometimes we have problem in life. What we used to do, we used to call a friend at 2 a.m., 3 a.m., dude, or I have this problem, solve me. So always our friend or the immediate seniors or super senior or sometime our juniors become our, they have become a good helper, or they suggest us sometimes very good thing, and that change our life many times. So same this discussion is there. It's a completely friendly discussion, but I will add my little experience, which I have got from my practice or from after doing my MDS or with the interaction of student or with my fellow colleagues. So this friendly and experienced talk is for you to help you and to guide you for your future. Because when we are in the internship, a lot of things come to our mind. In the beginning of the internship, we have full of energy. We feel like that we are doctors. Something different we will feel. But as the time passes, in the mid of the internship or at the end of the internship, the palpitation begins. It begins what to do now, yeah. After BDS, what we'll do? Some people who have thought from the beginning the ideal values that I'm going to do this thing only, they are safe. But many of time we are confused. Or sometimes what we have thought like that, we'll do this or that, but certain situation will not come into the bag, and we'll get confused, and we are at the crossroad. कि अब क्या करेंगे यार हम लोग? So that thing should not happen when you are in the internship, or when at any stage of life. You should not feel confused. Your mind should be clear, and always you should work towards that thing. So that will always help you in gaining success. Fine. So please clear your mind and work for yourself. So friends, think in the broader aspects. So let's get started the today lecture. So we have to talk two things. That is the clinic opening and abroad dentistry. So let's talk to the one of the favorite topics. Students keep on asking me about the abroad dentistry. So we'll talk how a dental student from India can go to abroad. As when you search in the Google, or there are a lot of YouTube videos are there which sometimes may misguide you. There are a lot of wrong information available in the market regarding abroad dentistry. Today, right now I'm taking lecture. I was knowing everything, but once again, I went back to all those authenticate website and I've read twice and I'm telling you. So what all correct information. So please always follow authenticate and correct information. Fine. So let's talk with the abroad dentistry. It's become one of the the light of the darkness. If you ask anybody, they feel that yes, India में dentist में बहुत competition है, abroad जाके हम लोग settle हो जाएंगे. That's a common thing is there. But dear friend, it is not like that. Competition is everywhere. See, if you are not able to survive in India, how you think that you are going to survive abroad? So don't think just to keep away or just to go away from those fear of competition you are going to abroad. Please don't think like that. You're going, if you're planning to go abroad, go for the positive things like that. You want to upgrade your knowledge, upgrade your dentistry, or you want to go to some other level. You want to going and you want to learn for something more and more. Keep the aspects in positive manner. So that should be the aim and goal of abroad dentistry, not to go away from the competition. Fine. So in this abroad dentistry, have paper and pen with you. I am going to tell you the authenticate websites, all the exam details step by step. So first, we are going to talk about the Canada. I have written all the information so that you people should not get any wrong things. So first of all, we'll talk about Canada. So there are two examinations there. That is NBD and NDEB. This NBD, that is a National Board of Dental Examination, is for the USA. Wherever this NDEB is for your Canada. What is this NDEB? It is National Dental Examining Board of Canada. Fine. So there are a lot of steps are there. First of all, dear friend, note the website ndeb.bned.ca. This is your website. Even I will give in the description box. So there are few steps when you go for the abroad dentistry. You have to remember three things. That is the family, money, and time. When you go to abroad, pros and cons are there. There are positive factor, negative factor also. The first factor you have to keep in mind is your family. When you go to abroad, you will be away from your family, your friends. So that thing you have to keep on consideration. Second thing, the money factor. See, it's not easy to go abroad because the exam fees, the traveling fees, the staying fees, everything is 10 times more than in the India. So that thing you have to keep on consideration. And one of the most important thing, the most important than money is your time. Time is very crucial, dear friends. Sometimes what happens that you people have not value the time right now. So time has been very critical factor in the abroad dentistry because the exam level are different, the exam level are difficult, and you have to check out the different exams have different timings. So time is very important. So three things keep in mind: money, family, and time before you go to the abroad. So let's start with the Canada. So three type of exams normally come. First is your language clearing exam, maybe your TOEFL or the IELTS. For the Canada and Australia we have IELTS, for the USA we have TOEFL. Then comes the initial assessment of yourself. What is this initial assessment? That they will check your professional qualification, whether you are fit for the further steps or not. In this professional qualification, many things you have to consider, like what all you have achieved in your all the 4 BDS year, how many conferences you have attained, national, international. Then comes how many articles you have published. Based on that, your initial assessment will be valued. Then second comes the equivalency exams. It is different for the different country. What this equivalency exam suggests us, that whatever your degree you are holding in the India, you have to make equivalent to those dental degree available in the country. So that is your equivalency exam. And third comes the certification process for the license which you have to give. So in this way, 3 sections will come: initial assessment, then second is your equivalency exam, and third comes the certification exam. After that, you will get the license and you can practice there. So for the Canada, the initial assessment cost you around $900. Fine. And second comes the equivalency process for the Canada. So the 3 exams are there. First is AFK, second is ACJ, third comes ACS. What is that? AFK means assessment of fundamental knowledge. ACJ means assessment of clinical judgment. and ACS means assessment of clinical skills. So these three exams will be there. All these three exams come in a period of six months. So around 6 months will take to give the exam, all the processing of the documents and everything. Fine. And the cost for each exam is around, for AFK it is $800, for ACJ it is $1,350, and for ACS it is $9,000. So the total cost of the exam is around $12,050. If you calculate in Indian amount, it is around 7 to 8 lakh. So these three are the equivalency exam for your Canada. Fine. Then comes your certification process. If you clear this exam in one shot, like for example, it will take around 1.5 years, then you will come back to the certification process. In that, two types of exam are there: written exam and OSCE clinical exam. What did OSCE means? It is objective strategy clinical examinations. Fine. And one important thing you have to consideration, that this two exam cost you around 1,600 to, we can say, $1,700. So in Indian, if money we calculate, it's around 8 to 10 lakhs. So only the examination charge is around 18 to 20 lakhs. Other thing like going, coming, and staying, that's a different thing. I'll talk about just examination purpose. The equivalency exams in Canada, you have to go in Canada and you have to give. And second is the certification exam, which I told, written and OSCE exams, you can give maximum 3 times. After that, you will not be eligible to give further exams. These written exams comes in 2 segments of around 150 questions. They will test your clinical knowledge. Then the second comes is OSCE clinical exams. What does exam consist of? You know, it is not like the simple MCQ or like that exam. In this OSCE clinical exam, you have the windows will be there. In windows, 5 minutes you have to go to one window, 5 minutes second window, like that the procedure will be there. And mostly the questions they ask are extended matching type of question. Last year in our AIMS exam, they have asked such question, extended matching type. You can check out my video. I will give in the link that what is this extended matching type question. In short, I will tell you, for example, they will give the complete case history of the patient. Name, age, chief complaint, history of present illness, till the diagnosis they will give you. Then the questions will be there, multiple questions like that, what all treatment you will deal with, what all diagnostic test you want to go for it, how the prognosis will be there, like that the different questions will be there. The passing for this is that if you get more than 75 marks, you are passed. If not, less than 75, you are failed. So this is the basics of your Canada exam. Fine. So you require around 2.5 to 3 years if you give in one shot to clear this exam. Examination fees is around 18 to 20 lakhs. Fine. So we deal with 3 exams. Initial assessment comes, then the equivalency exam, your AFK, ACJ, and ACS. Third comes your certification exam, in which one written exam and one OSCE clinical examination is there. So that was for your Canada. Now comes to the toughest, that's a USA exam. If you want to practice in USA, the DDS is mandatory. DDS or DMD is almost same, it is mandatory. So for USA, you have to clear first NBD part 1 and part 2. Before few days, I uploaded on my FB page and everywhere. Now the NBD is planning to integrate this part 1 and part 2 into one. That is a INBDE, integrated NBDE. So the chances are there from Australia, you will have, from 1st of August, you will have one exam only. Then after 6 months, you will have the bench test will be there. In bench test, they will check your clinical knowledge from the mostly endo, operative, and the prosthodontic point of view. So you require minimum 1 year to clear this integrated NBDE exam and to clear that bench test. After that, based on your score, you have to wait for 6 months to get admission in the university for the DDS program, which is for around 3 to 4 years. Fine. So this is the process for your USA dentistry. So if you want to go to USA, remember you require a time period of around minimum 5 years, and that the money is big because of the admission in DDS. Around 80 to 90 lakhs you require minimum amount, plus your staying, going and coming, all expenses are different. So that was your Canada and USA. So just want to tell the website for the USA also, that is ada.org. We get all the authentic information from there. So we have seen about the Canada and USA. Now comes to the one more favorite place for the student to go, that is Australia. So the website for the Australia is adc.org.au. This is the website for Australia. So in Australia we have three things, that is initial assessment, written exams and the practical exams. So three steps are there. So for initial assessment, you are sending your documents and forms. It will take a period of around 8 weeks. And the cost for the initial assessment is around 610 Australian dollar. So if you calculate, it comes around 30 to 35,000. So that's your first step. If your documents are eligible, then you can go to second step. Remember, dear friend, in this initial assessment, it is not simple that you will send the documents and they will make you eligible. A lot of things are there. You require a transcript, you require a recommendation letter from the higher authorities, so, and also your personal academic achievement should be there. Like if you have got some highest mark in any subject, or you are university topper, or you have attended any conference, you have presented any paper, all things will be considered in your initial assessment. Then you can go for the second step, that is written exams. So dear friend, this written exams in Australia is completely clinical based. Yes, Hemant, I'll check, it's buffering. I hope now the network is proper, maybe because of network error. So where were we? Yeah, we are on the second step, that is the written exams. The written exam for your Australia is slightly different. Fine, it is completely computer based. Then it is based on your clinical judgment and your reasoning skill. Most commonly, twice this exam is conducted, that interval of six months. You have to give around a period of 5 to 6 months for all the processing of exam and everything. The cost for this exam is around 2,000 Australian dollar. So it's around 1 lakh rupees. This exam mostly consists of 4 papers. 2 days exam will be there. First day the paper 1 and paper 2, and second day paper 3 and paper 4 will be there. So around 80 questions they ask in the exam. Per paper you have the 80 questions. Fine. The advantage is that this written exam you can give in the multiple location. In India we have different location, like you can go to the, in Ahmedabad is there, Bangalore, Kolkata, Mumbai, around 8 to 9 location is there where you can give this written exam. That is one of the advantage of going to Australia. Then if you are eligible, if you pass in the written exam, you can go to the third exam, that is practical exam. Remember dear friend, in this written exam you have to pass all the 4 papers. They will give the grading A, B, C, D, E. A, B, C means you are pass, and D and E means you are fail. So you have to clear all your 4 papers. After you are eligible, you have to go for the practical exam. This practical exam will be in the Australia. So for that also you have to fill the form. It takes around 6 to 9 months, and the cost here is around $4,500. If you calculate in Indian amount, it's around 4 to 5 lakh rupees. So this practical exam also they conduct for 2 days. First they check your technical skills, and secondly they will check your clinical skills. Fine. And dear friend, this exam is it's very tough exam. If you go for the practical exam in the foreign, is one of the toughest exam. One of my friend was there in the Australian Dental Council. I was associated with him, and I've seen how in very meticulously they are conducting the exam. It's not like our Indian exam means just we have to go for cavity preparation like that. They will check with each, and they will check with the vernier caliper the amount of depth sometime. So it's one of the toughest exam out there to clear that practical exams. So in this way, there are the 3. There's an initial assessment will be there, second written exams, and third practical exams will be there. After that, you are eligible to go for the license which are produced by the Australian Dental Council. So friends, these are the 3 major countries I have discussed. That is your Australia, second I have discussed your Canada, and third I have discussed your USA. So you have to keep in mind, first of all, your family values. You have to check your financial things, that you can spend this much or not. Third thing, you have to consider your time, because if you are doing MDS in India, it is for sure short there you will able to clear up within 3 years. But such thing is not there for an exam, because you clear one exam, you fail one exam, situation are not ideal, so it can go 6 months, more or less. So you have to think and you have to decide. So that was all for your abroad exam. Somebody have put in the UK that for that we'll discuss in the separate lecture that what all UK, mostly what all ORE exams and all that come. We'll discuss that also. Now the second things come is your clinic opening. You know, the clinic opening is one of the biggest chunk, or for everybody we want to open the clinic because we are the doctors. So, but before opening the clinic, we have to keep something in the mind. I have made one acronym that is EPIC. Hope everybody have seen in my previous videos which I uploaded. That E stand for the exposure. P stand for the patient management. I stand for the independent confidence in handling patient and other things. And C stand for the core competency of the clinical works. So dear friends, when you go for the, we can say about the exposure, E, you should have the enough exposure of doing the patient. What happened when we used to do the MDS before, sorry, BDS before 10 to 10 years, we had a lot of patient because at that time the MDS was not there. But nowadays in most of the private colleges, the majority of chunk of patient go to the MDS. So when you open the clinic, you have to ask yourself that whether you had enough exposure of doing patient or not. On that aspect comes the second, that's the patient management. Because when you doing the patient, you cannot consider the patient as a practical. Because when you are opening the clinic, around you, many dentists are there. So you have to do the perfect work. Now imagine you have not done the proper work, then that will degrade your name. So before opening the clinic, this exposure and patient management should be proper. Third comes the independent confidence. You should have the basic idea that what you are going to do. Your vision should be clear. You can do independently any patient. It's not like that when you are doing the patient and some mishap happen and you can leave the things. Your patient is there and you have to take care. In college, what happened? We used to have the staff, but after college, we don't have the staff. So that confidence has to be developed. And most of it comes by practicing and practicing. Fourth thing comes is the core competency of your basic clinical work. When you open the clinic, the thing has to be sure in your mind that you know the basic procedures related to day-to-day practice. Yes, consultants are there, but you should have the proper idea for the specific process and you should able to do also in proper manner. If not, you can call the consultant also. So this EPIC you should always calculate before opening the clinic. Now there are a few mistakes done by the student that remember when you're opening the clinic, you should ask yourself where you stand. You should not compare yourself with the old dentist working in your area. Remember dear friends, they're working from 5 years, 7 years, 10 years. They've established themselves. When they come for the practice, they were alone. Nobody was there for the competition. But now when you are putting the steps in the society or in the market to do the practice, many competition is there. So you have to do something different, or you have to upgrade yourself, maybe in the terms of MDS, that help you to differentiate from those practitioners working from the many years. And sometimes many of you are messaging me and they are asking me, sir, abhi bhi MDS ki halat hi bahut kharab hai. So why to do the MDS? Dear friend, that thing is not there. I'll tell you in my next lecture that what are the pros and cons related to MDS. But one thing I will tell you that if I have passed MDS this year and I'm in the market, you cannot compare me with those practitioners working from 10 to 15 years. You cannot compare with me. But one thing is sure that after 2 to 5 years, I will be matching to them or I will be ahead to them because of my upgradation or my specialty. That thing you have to always keep in your mind. Because nowadays, if you see the tier 1 city or the city area, the thoughts of people are changing. They want specialists. Yes, but in case of the outskirts of the city, as a BDS, enough exposure, you can open up the clinic. No doubt in that. But before opening the clinic, you should have the enough confidence and exposure to get through the patients. So this two things should be there, four things should be there before you open the clinic. Fine, dear friends. So in this video, we are talking about two important things. There's abroad dentistry and the clinic opening. And dear friend, because of this COVID-19 situation, our academy has decided to provide a complimentary lecture series to the student. If you want, you can message me and you can join. In this complimentary lecture series, we'll have the live session. We'll have webinar lecture. My webinar lecture are very different. It's systematic. We have the proper image, proper voice notes, proper explanatory videos are there. Then we have a live sessions in which we'll discuss the things. The links will be provided before only. So any of you want to join or your friend want to join can WhatsApp me. We'll add you to the group. Fine, dear friends. So that was all for the today's lecture. Now we'll go for the chat box and we'll see any doubt you have. You can ask me whatever doubts you have. So I'll see, I'll scroll the chat box, what are the questions are there. So somebody is asked me regarding Italy also. So good thing, Manpreet, I will check about it. Italy, I am not knowing. Frankly, I'm saying whatever authentically I'm doing, that only I'm telling, because most of the students prefer for this 4-5 countries, the US, UK, New Zealand, Australia, and the Canada. So I explained that only. If you want Italy, you WhatsApp me. I will explain you. My WhatsApp number I will provide in the description box. So friends, I am waiting for your questions. Whatever questions you have regarding abroad dentistry or regarding the clinic opening, you can ask me after BDS. Next session after 2 days, we'll talk about whether to do MDS or not, what is the scope in government jobs, and third, what is the importance of the short clinical courses you are doing. The 3 options we'll take after 2 days. Yes, Dr. Godavi, the tentative cost for the opening of the clinic is depend on you. If you are taking your own place, the cost come little bit high, around 50 to 60 depending on place. But if you want to go for the basic setup in a rented area, it's around 5 to 6 lakh. You can go for the good setup. And yes, Dr. Ayman, the Gulf country for the BDS, the scope has become very less. That's why I'm not explained. Even for the MDS, the scope is not that much. You have to give some exams are there, like DHA is there. Yes, for the Qatar, Dubai, the exams are coming. You have to give that license exam, and directly you can practice that. Many of my friends are there. So one of my friend, Dr. Amit Boliwal, is a good endodontist. Is working there. Hopefully, is watching the lecture. He can tell you. It's very beautiful. After MDS, you go, you will get good salary. But after BDS, the scope has become little less because of they have the university, so they are hiring the BDS people, and many of the MDS from India are going there. So for the Gulf country, you can go, but you have to give few license exam, like DA exam is there, HUD extra exams are there. Simple MCQ exam will come, and you can go. You can try out that. Or that some books are also available, like Dento Gulf is there. In that first 20 pages, they're given all the information how to register for this Qatar, Dubai, everything for every state they have given. You can read it once. More information in that. We'll plan one more lecture like that for the Gulf country also. But it's one of the good option. But I'm saying it's a easy for the BDS students nowadays. For MDS, it is scope is little high, so you have to keep all this in consideration. So friends, time is around 5:30. We'll wait 5 minutes for the chat box, and we'll wind up with the lecture. And if another doubt said, you can put me in the comment box, or you can WhatsApp me. Yes, I have given my WhatsApp number also. You can message me anytime. And our website is also there. There is mdsdentalacademy.in. You can go there and you can watch all the things. And friend, one paper and pen theory I used to follow in my life. That whenever I'm confused, I used to take 2 papers where I used to write the pros and cons for everything. And I used to deduct and I used to weigh whether that pros is more and cons is more. So if pros is more or the benefit is more, I go for that thing. And the other options I used to throw in the dustbin. Like I want to tell my life story that when I was going for my counseling, I was getting all the seat except ortho. So options were there in front of me. So I jot down that I should take pedo, endo, or I want to take the peri also. So I written the pros and cons for that. At that time, I think that my pedo is good. So all the 2 other options I have thrown out in the dustbin. So we get the confidence, and whenever we remember that kash maine endo liya or peri liya hota, at that time we remember that yes, my option is correct. So you can have this pen and paper theory, 2 empty paper take, write pros and cons, weigh your benefit and risk, and take your decision. That sometimes helps me. So basic salary after BDS in Gulf is very minimal difference, around 1 to 1.2, and all the expenses you have to bear. But if you go after MDS, the salary is around 2.5 to 3 lakhs. See, dear friend, public health dentistry abroad, there's a MPH you are talking, which we are discussing in the second video. The scope is very minimal out there. You will not associate with the dentistry, and you will go with the another thing. You go for the public health program outside, the scope is very minimal, and the salary is also very less. So that much, you can say that in broader aspect, the PSC is not that much good in the foreign country. Yes, Dr. Kaushar, for NEET MDS preparation also, we are planning one video. Yes, you have the 9th edition of Pulse, no problem. You need not to buy the new Pulse, no need to buy. You should have either a dental Pulse or the dentist. And for the new questions, you can buy Neeraj Vadavan. And along with those MCQ books, you have to keep in mind, and you have to read the clinics or basic textbook also. I always say now the exam pattern has been completely changed. It's not like that before 4 to 5 years where the student used to mug up the MCQ book and they used to do. But nowadays the thing has been changed. You have to read the concepts and that from the textbook. I will deal in my third video that how to read the textbook, how to approach MCQ, everything we will see in the future lecture. Yes, how much the difference between salary after BDS and MDS? See, dear friend, first of all, I'm going to tell you that we are the health providers. We are not there to do the job under someone, but we are there to create job. So if you do after BDS, we have seen many people are exploiting the BDS student. But after MDS, the two things will be open in front of you. That is a consultation. You take any of the clinical branch, the consultation is always open to you, and you will earn very good amount. And also the chains of clinic have been opened. I don't know name them, but they are also providing good salary to the MDS, around 40 to 50,000. Many of my friends are working in such chain of salary. Even Dr. Nitha is there, my junior. They're getting good things. So that you have to keep in consideration. After BDS, don't expect for the salary, but after MDS, yeah, chances are there. We'll go for the consultation and you will earn. And second, in such chains of clinic, they may hire you, and there you can get around 30 to 50,000 based on your clinical skills. So please, you have to focus on concept when you are doing your NEET MDS preparation. Yes, Kausar, you are telling is correct. The clinical has a weightage around 55%, but 45% basics are also there. So you have to keep all things in mind, and you have to keep on going. Sorry. And you have the skills you can earn at any time. That's for sure. Any questions regarding abroad dentistry, or if you're confused regarding anything clinic opening, or that you can ask me. I hope everything has been clear for the abroad dentistry. I will write the website in the description box also, and I will mention for the each country which all exams you have to give, and then also about the money aspects also, and time duration you require for each of them. I hope you might have written everything. If not, this video will upload again, and you can check out there also. Is how to fill the form after registration in the PGI. It's a simple thing only, dear friends, like your NEET only. You have to give just a basic information. Any other doubt regarding fill form, that you can WhatsApp me, I will tell you. But form filling is very simple. You take the two thing consideration, your photographs and your signature. The name should be there below your photograph, and proper KB, you should convert your signature. These two things are very important for PGI. And things are simple. See, Dr. Kausar, you have to keep on repeating and revising. Then you will be confident for your NEET preparation. The revision is the key, as well as the proper schedule you have to prepare. I always believe in the pyramid of NEET preparation. The base is your synopsis or your notes, your textbook reference. Second comes the MCQ, and third comes your revision. So if these three things have been corrected, you have to be in confidence. So don't worry, we'll discuss that thing, that how you have to read also. What about no? See, Dr. Rameshwar, I have mentioned in my last video the scope for the MDS branch. Yes, non-clinical branch. I have told in my last video there is no word like non-clinical. It is semi-clinical. You can go. I will keep the link in the description box. That what are the scope for different branches. I have uploaded in the last my live YouTube lecture. You can go in there. But yes, the semi-clinical branch like oral pathology, oral medicine, public health dentistry have a good scope because the upgradation and the time is changing. Example of oral medicine I will give. Previously, oral medicine was not associated with any clinical work, but nowadays, because of the opening of CBCT center, OPG, advanced diagnostic tool, implant dentistry, oral medicine, people are earning like hell. Oral pathology, people are also earning good because of the cancer screening and everything. They are also been appointed in the general pathology lab also. So semi-clinical branch have a good advantage. So don't worry. You have to take the option if you believe for your good semi-clinical branch is good. You have to go in. You have to work for it hard, and you have to create the difference for that. Number has been given above. Once again, I will say it is giving my description box also. You can check it out. The number in the description box along with the email ID and everything is there. Number, email ID, my website, everything is have been provided in the description box. Even the link for the MDS branch also, that I will also provide. And one more thing, dear friends, I want to tell that whenever you want to take any decision, don't think that if my friend is taking will be good for him, that will be good for you. You should note down how your scenario is there, how your environment is there, what your condition is there. Based on that, you should take. You should not, for example, some of your friend is going to abroad or opening clinic or doing MDS, blind will follow him or her. No, you should calculate what you want and then take the decision. Sure, sure. This regarding books, one playlist is there. The what books you have to refer from the first, second, third, final year for your entrance. You can check out. I will put the link for that also. Sure, Dr. Ahuja, I will put. Wait for 3 more minutes, dear friend. Then we'll wrap up with this live lecture. Tomorrow we have a WhatsApp lecture on the removable partial denture. If anybody want to attend, can message me. Day after tomorrow, we have a live lecture on the physiology topic, that is endocrinology. After that, we will have one more live session, that is what after BDS part 2. I will discuss with 3 things that I have told you, MDS or not, government exam scope, and about the short clinical courses many of you are doing. And please don't waste your time in this lockdown. Keep on working toward yourself. Keep on working for your dreams. Because after 20-25 days, when everything will open, you have to prove that this 1 month you are not wasted. You have to create value for this 1 month also. So please keep on working. Don't waste your time. You can WhatsApp me, Dr. Manpreet. I can tell you the lecture time and everything. We'll add you to the group so you can attend the lecture. Yes, Dr. Costo, for USA, the DDS is mandatory. If you want to practice there, you have to do the DDS or DMD. But for Dubai, you have to just clear the license exam. That is, DA is coming for another Abu Dhabi area like that. HUD is coming that you can give. For that, you have to go for the registration, and then the MCQ type exams come. Then they will give you procure the license, and you can apply for the job in Dubai or HUD or anywhere. Then they will send the call letter, and you can go there. So it's a step-wise process there for Dubai. First, you have to clear the exams. You have to the ranks will be there. Then with that registration, you have to apply in the hospitals or university in Dubai, Abu Dhabi, or any United Arab Emirates country. Then they will see whether you are eligible or not, and then they will send you the call letter, and you can go and work there. So friends, just 30 seconds have been left. After that, we'll wind up, and I'm very happy that you all people join. and thankful to you because it's very good that I love to talk with my students and I do love to interact with them, and they came, and it's very good moment for me. Welcome, Dr. Kaushar, and please work hard. My sincere advice to you all people that don't think that dentistry is saturated and just leave on the things. Think that dentistry is upgraded. If you have the knowledge, the money will come to you. The money has to come to you because for two things we work, three things basically we work or we study. First is that for the good image or good respect in the society. Second, we work for that we should have the proper money, and third, for the happiness of us, ourselves, and the family. So these three things will fall on if you are the good dental surgeon. If you are practicing good, automatically you will earn. Automatically you have a good value in the society, and automatically you will be happy and your family will be happy. So our basic ultimate goal is where you should be good dental surgeon, and you should strive and you should upgrade yourself. So friends, that bell has rung again. The time is over. So see you tomorrow with the things. Yeah, are there any scholarship for studying MDS in India? No, dear friend, the scholarship are not there. But you can work hard and you can get in the good government colleges. There are around 300 to 350 seats are there in government college, and it's not tough to get in government college for the MDS. If you work hard properly, you can get it. Scholarship, I don't think it is there in my knowledge. If there, definitely I will upload on my FB and Instagram in this YouTube link. So friend, that was all for today. Thank you all. Stay safe, be happy, don't get demotivated, and keep on working towards your goal. Any doubt, my contact information is there in description box. You can contact me anytime, anywhere. That's all. Bye, dear friends.